नमस्कार, येवकार तुमकां ह्या पॉडकास्ट कार्यावळीन. आमी जेन्ना आमची भलायकी म्हणटा, हेल्थ म्हणटा, तेन्ना एक आस्पेक्ट आमी इग्नोर करूं शकनात, तें म्हणजे आमचें ब्रेन. आनी फाल्यां ब्रेन जर सारकें ना जाल्यार बॉडी कितलीय सारकी आसली जाल्यार कांय फायदो ना. आनी ब्रेन रिलेटेड जो मनीस डील करता, म्हणजे डॉक्टर डील करता, ताका आमी म्हणटा न्युरोलॉजिस्ट. आनी न्युरोलॉजिस्ट हो खंयच्या हॉस्पिटलान एक म्हत्वाचो डॉक्टर आसता.
In association with Manipal Hospital's Dona Paula.
आतां ब्रेना विशयी आमकां आसपी वेगवेगळे प्रश्न जाणून जावपा खातीर, ताची उत्तरां जाणून घेवपा खातीर आमी खास करून आपयल्ले आसा. आमचे मदीं आसा मणिपाल हॉस्पिटलांत न्युरोलॉजिस्ट, कन्सल्टंट न्युरोलॉजिस्ट म्हणून काम करपी डॉक्टर अमृत एस. वेलकम सर.
Thank you so much.
So we will speak in English and Hindi. So first of all, when we speak about brain, the first question comes is we speak about mobiles and especially social media. Now one question which parents usually think is excess use of social media. Does it affect your focus or does it affect your brain by any chance?
Definitely, yes. At least in this generation, I would say it is one of the most dangerous thing that one has to be brought under control. Because watching mobile phones could be using of the excessive social media, especially these short reels, short videos. What they are doing is they are just giving you a dopamine hits. They are taking you into such a dangerous loops where you are getting addicted, and just to get that short dopamine. Dopamine is one such kind of a hormone which usually get released during the pleasure some activities. So this hormone, for this hit, they are into this kind of a social media activities. Along with this, there is also something called as a FOMO, fear of missing out something. We keep on checking our phones just to just to make ourselves sure that we are not missing out anything. That leads to a unnecessary anxiety and then stress, which releases a lot of stress hormones in our body. So all these things, in a way, they are affecting our part of the brain which helps in decision making, learning something new, or else storing the memory and all. So in that way, the brain function will keep on declining if we are stuck into these kind of a social media related things, as well as a short term attention seeking related videos and all. That will definitely reduce your brain function.
Our attention span has been reduced. We have seen that if I show you 5 minutes of video, you will watch only 1 minute of it, then you just try to tend to get bored unless and until there is some hook which keeps you hooked to that. So is it because of this excess information that we are consuming?
Yes, definitely, sir. That is what I was talking about. That attention span has got reduced because we watch that particular video until and unless till the period of time I get that dopamine hit. Within few seconds, or else say within few minutes, that pleasure will be lost. Then I will scroll down to something which is again more interesting. If not, I will reach to that extent. I'll keep on scrolling, in fact, actually, till I get that particular pressure or else the kind of a dopamine hit.
Focus is what we are discussing. We also tend to lose the focus if we keep on watching the mobile or content on the mobile.
Yes, definitely. So this focus is something I need to do a activity with a mindfulness. I have to stick to one particular activity and then keep involved in it. Then only I can learn that activity. That is what focus is. But when it's come to the social media, especially the short reels and all, there are so many things which has been kept in front of us. So I'm not able to choose anything. I'm just doing that for the sake of relieving my anxiety or else getting the short pleasure. So definitely focus will be lost if I am into such kind of activities.
So for our eyes, whether it is inside the mobile or outside in the real world, if we see too many things, it might affect the brain. So my question is, how different it is to see this thing on a mobile and to see the thing in the actual real world.
In the actual real world, yes, it is a kind of a physical activity where I have to go and then reach that particular place. And in in such kind of activities, I'm going to that part. But for example, I would say go to a garden or else look into some kind of a nature activities. I will get involved in that particular things maximum, right? So in mobile phone, by sitting at inside the house, I am getting exposed to so much of unnecessary data. Okay, so the thing is, if you are watching mobile itself is not a kind of a bad thing, I would say. If you are watching something which is a healthy or else something, a skill learning kind of activity, not only that, in case if you want to watch some kind of a real entertainment videos and all, you can stick to that particular period. You have to restrict yourself. You have to have a self control on it. You watch a video completely, that is not a problem. Watching it to the limit which has crossed, and then your screen time is too much, and you are fluctuating your thoughts just by looking into so many things. That is what actually the problematic with the mobile phone.
So thought change of thought from
Change of thoughts.
one video to another video is a problem. So
Where
if
you
I
are-
watch a video for half an hour,
Yeah.
then it's not a
Definitely,
problem.
whatever it could be, just for the kind of a entertainment purpose or else for the learning purpose, you can watch it for a period of time. In fact, internet is a kind of a gifted thing for us. We must know that how to utilize it rather than taking a misuse of it. What we watch is also what we are basically. We know that what we eat we are, but simultaneously what we watch is also we are actually.
So what is a time period that is prescribed? How long should we see the videos, or can we see the video?
Nothing like that as such basically. There is no particular limit of time, but if you go through the internet, what is the maximum screen time? Because these days in phones we can usually set the screen time and all that. They say that 1 to 2 hours of a screen time, max to max 4 hours of the screen time is which is allowed in particular 24 hours of the period. It all depends on the each and individual, like into what profession he is, what he is doing. For example, for a busy engaged person, entertainment of 1 to 2 hours is not a big deal, I would say.
So another thing is radiations. People discuss about radiations.
Yes.
Now to use mobile, does use of mobile affect your brain?
Usage of mobile phones, as we discussed with that kind of reels and then a shifting of the activities and then changing, getting addicted, it is something, and then getting exposed to the radiation, it's a very debatable thing, I would say. But definitely these days we come to know that radiations are definitely hazardous to the brain of a child who is growing. At least basically the skull is little thicker. Even the Wi-Fi radiations, even the mobile tower related radiations or else any kind of a radiations are definitely hazardous to the brain development, that I can say. But when it comes to the elderly people and the younger generation, will the mobile radiations and all directly affects? That is a matter of a question. It's a debatable thing, I would say.
So one thing everyone wants to know, जानना चाहते हैं लोग कि अगर मैं फ़ोन उठा के ऐसे बात करूं ठीक है, या फिर मैं ब्लूटूथ लगा के बात करूं ठीक है, या फिर मैं वायर्ड ईयरफोन्स लगा के बात करूं.
Correct. So yes, any kind of connectivity in the sense Bluetooth, it has been told that yes, you are getting exposed to a little bit of a more radiation. So using a wired headphones is again, which is a comparatively better. That is what certain internet data shows basically. Bluetooth, I think we are getting exposed to a little bit of a more radiation. So in any way radiation is harmful, so it is better to take a precaution.
सीधा
in that
फोन
manner.
उठाया और कान को लगा दिया
direct
That is
phone,
better?
speaker phone will using a speaker is always again a better rather than directly getting exposed by using the mobile phone onto your ear. In fact, we say that during the charging of the mobile also there is an increased release of those radiations, so one should always be aware about like not to keep their phone on charging and then sleep beside that. That is what being discussed these days a lot on the
You are
internet
practicing in Manipal Hospital. Are you getting such kind of cases because of kid who is excessively using the phone? The kid is on social media, that's why she's not studying or he's not studying, they are not focusing, do they come to you and do you have any solutions for that?
Yes, definitely. At least, in fact, I'm basically an adult neurologist. Just many of the psychiatrists as well as the pediatric neurologists are coming across such kind of cases. In fact, I also come across such kind of cases. The only way is, it's been said by the Pediatric Association that for up till the 2 years of age, there should not be any exposure to the screen. Zero screen time has been proven by the many of the studies, because the children are ending up in many kind of problems where they are not able to attain the milestone, they are not able to learn the language, they are developing bizarre psychiatric disorders, they are losing the interest, and they're just throwing up in various various behavioral related problems. Definitely phone should not be, or else any kind of a screen should not be exposed up till the age of 2 years, and after that also there is a particular cutoff time for that.
What kind of patients do you encounter in your clinic every day, especially when it comes to phones and neurology?
Especially the headache, I would say. Headache is the one of the most common, and it is a invisible disability, I would say. It is such kind of a problem where it is either misunderstood and then underdiagnosed basically. And because of the excessive usage of the phone, people are having the headaches and migraine, and also the stiff neck and other other mental issues, stress and forgetfulness. These are the various things which they are presenting, and among them, if I ask them like how much is your screen time, definitely they would agree for that.
So if you reduce the screen time, your headache is taken care of.
Yes, see, headache is basically a very vast topic. Certain headaches which are exertion related, or else in fact migraine related headaches, can be brought under control just by reducing the screen time.
What is the difference between headache and migraine? How do I know that I got a migraine?
Migraine, definitely headache. Migraine is a part of this headache spectrum disorders, I would say. So migraine is such kind of a problem where I would not say that it is a straightforward, it's a disease. It is a tendency for someone to get the headaches. If you are getting exposed to certain triggers, there is something called as a hypersensitivity in the brain, which is occurring, some kind of a chemical reaction that is leading to the release of many chemicals in the brain, and that is causing the headaches. As I have mentioned, it is an invisible disability. At the outside, person will be looking all right, but his brain will stop functioning for that period of time. So in migraine, it is classically said that it is a kind of alternating headache. It comes on to the one side associated with some kind of a pulsatile feeling, throbbing kind of a headache, where they will get some auras either before or else during the headache, and they will be feeling that tendency to have that nauseating sensation. That is what actually migraine is. It is more of a tendency to get the headache because of certain triggers.
Is migraine avoidable disease?
Yes, by taking proper precautions, migraine can be easily controlled, and one can be easily get rid of it, basically.
Suggest how do I save myself from getting migraine?
Yeah, migraine, as I have mentioned, it's a trigger related headache. It is secondary to the certain triggers. There is something called as a SEEDS, a mnemonic, I would say. SEEDS in the sense, S means stress management, which is most important. By managing your stress levels, you can easily get rid of such kind of a migraine related issues.
You can prevent migraines.
We can prevent migraines, yes. So SEEDS means, S means managing the stress. E means exercise. Exercise, at least 30 minutes of a walk will going to give you a lot of benefits in patients with migraine. Another E for
walk on a treadmill or walk on in nature or outside.
When the nature related walks are always better than that, but it is anyway treadmill or else it's the nature. It is again a very debatable thing. Any kind of a aerobic kind of a activity, rather than putting yourself into the strength training and all, these kind of aerobic activities are having a very proven role in controlling the headaches because of migraine. And then eating on time and eating a balanced diet is also having a very proven role in managing the migraine related things. Next thing is diary. You have to maintain a proper diary with what you are getting the headache. What are the trigger points for you to get the headache? Is it something food? Is it some kind of a stress, or else kind of a outside travel, getting exposed to certain smell, lot of loud lights, loud music, excessive usage of phone? That you have to identify, and then you have to cut down. With that you can get prevented yourself from the migraine. The last thing is S, proper adequate sleep. At least 7 to 8 hours of a sleep is needed for your brain. Sleep is the ultimate food for your brain. So with that also you can easily bring down your headaches.
So now with this social media, again invasion of mobiles, can we now classify headache as a lifestyle disease?
Yes, definitely. It's a headache is a part of our lifestyle related problems. Yeah.
So what kind of patients do you encounter, do you meet every day in your clinic?
Other than headache, you want?
Other than headache.
Yes, as a neurologist, headache is the one of the most common problem where I usually see the patients of this problem. Other than headache, we come across patients who are having stroke, seizure disorder, memory related things, movement disorder, in the sense Parkinson related problems, nerve related problems like neuropathies, spine related problems, so sleep related issues. So they are all the various patients who we come across as a neurologist.
Do you see any particular trend as far as Goa is concerned in neurology, trend of diseases in as far as Goa is concerned?
Yes, in Goa I would say definitely Goa has a very wonderful health system, I would say. So patients are reaching on time, and then patients are seeking a proper help these days. If you ask me, neurological illness in Goa, which are quite predominant, headache is one thing. Other than this, stroke patients are quite high. Along with
brain
that,
stroke,
brain stroke related patients, yes, definitely. Parkinson's, that is a movement disorder related patients who are having a tremors, uncontrolled tremors, and patients with the memory problems, that is a dementia, what we call. Even patients with the nerve related issues, they're all commonly seen patients in Goa.
When we speak about memory or memory loss, first I want to ask you, how do we have a capacity to store memory in your brain?
Yes. What happens, the memory, we have a circuit, something called as a Pape circuit. It is a neurological term what I am using here. Whenever I listen to something, it will go into my one particular lobe of the brain called as a temporal lobe, where I start storing the recent or else the immediate almost memory into it. So over the time, if I keep learning something, that will get solidified, and then that will reach my neocortex basically. That will lead to the increased network in the brain, and that will become thickened, and it will be stored as a long-term memory. So in memory, we divide it as a immediate memory, recent memory, and then the remote or as the long-term memory. There are different classifications of the memory, but for a layman, I would say this is how the memory gets stored.
How do you quantify? Do you have any size, like we have when it comes to computer, you have TBs, MBs. So how much TB memory do you store in your brain?
No, we cannot really quantify it, and it all depends on each and individual patients, like how active they are, how much educated they are, how much they are practicing a healthy lifestyle. So it all varies based on the capacity. Someone who is really very much educated, who is really into a very good lifestyle, his diet, his sleep, his activities, learning skills are superb, then we call them as a person who can have a really very good brain, very good memory, and then the very good skills. Someone who is not so much educated, not so much practicing the good lifestyle, again into addictions and all, definitely he will going to suffer a lot in upcoming days with the memory related issues and all. It is all about the networks in the brain. It is all about the synapses, I would say, the neurons. That is how we usually store the memory. Cannot be quantifiable. There are millions of the neurons.
Can you reset the brain?
Resetting the brain, no, I would not say anything term, because it's more of a technical term, I would say. Biologically, there is nothing like that.
Nothing.
Yeah.
Like if I want to say, okay, I want to get rid of this memory, and
that is quite unfortunate. The more and more we try to do, it's a more of a psychiatry related thing, I would say, psychological related thing. More and more I stop thinking about something that worries me a lot, actually. That is something else. It is into the meditation, what we know. The moment if someone asks me to stop thinking about the pizza, I will continuously stop thinking about the same thing. Rather than that, we must concentrate on the mindfulness. So whatever comes to my mind, let it come, but I will involve myself into the healthy activities. That is how we should be.
Okay, just I want to know from scientific perspective, when we speak about meditation, when you sit for a meditation, they always advise, let the thoughts come, let the thoughts come, let them come, let them come. And then they say, ki, okay, it will cool your mind. So my question is, how do you cool your mind when your thoughts start coming, and when you're sitting for a meditation, you keep on thinking, aaj ye karna hai, mujhe ye karna hai, yahan jana hai, wahan jana hai. And it's point, there is no point in meditation.
Correct. So for a philosopher, the mindfulness is something different. For a layman, it is something different. For a scientist, for each and every individual, meditation and then mindfulness has to be addressed differently, I think, sir, actually. The thing is, if someone asks me to meditate, I'm having a lot of stress in my life, or else something, a patient comes to me, sir, so and so, I cannot advise them straightforward a meditation. In fact, many psychiatrists say that you should not meditate if you are into so much of thoughts, because that can harm your thinking process. The best thing I would suggest to my patient is a simple walk. Simple walk is something like a mind in motion, or else a meditation in motion, MIM, what we call as basically. The walking is one of the best way to get rid of chronic diseases, to get an immediate good thing, and to have a very, very strong cardiovascular system as well as the brain. What happens during the walking without any kind of a music in a especially greenery, what happens during the walking, you are focused into something where you are just moving with, let the thoughts comes, it doesn't matter to you. You are more focused on to your health. You have to make that a daily activity, then you will be stuck into a healthy lifestyle. For a moment, if I tell that if you're going for a walk of 30 minutes, you don't come back and then start drinking or start hogging up something. You will be moving towards the health. I go for a walk, I will have a healthy breakfast, I will just spend a very healthy working hours. I come back by the evening, if possible, take another second walk. I will sleep on time because I have to get up for a walking on the next morning. If you practice these things over a period of 2 weeks or else 3 weeks, that person will be stuck into that particular loop, and that will going to give him a best result in terms of a mind as well as his health as well as the brain, I would say.
So walking also helps your brain. It doesn't only help your other
yes, it
systems, but
helps
also brain.
in all throughout, I would say, because walking and then the exercise release something called as endorphins in the body, which are a good and then the healthy hormones for our body. That will, in fact, they are the natural painkillers also.
How long you should walk every day?
At least, as per the books, as per the guidelines, 150 minutes of walking in a week will prevent you from many diseases. At least, I would say. In that way, it is 30 minutes, 5 days a week, minimum you should go.
30 minutes.
30 minutes per day.
Preferably in the morning.
Preferably in the morning.
Or late in the evening.
Is also okay, but morning walk, I think it has a very better proven results than the evening walk.
Now give us some tips how to keep our brains healthy.
Okay, great. So as we are talking about the walking and then the exercise, it is one of the major factor what will going to contribute me for a very good brain activity. Second one is the diet. What we eat, we are, in fact, actually. So consumption of the balanced diet. I'm not saying that you should get rid of pizzas, burgers, and you should always start eating the boiled food or else a kind of a Mediterranean diet, but you should have a balanced diet in your brain. Your diet should be rich in proteins, it should be rich in fibers and less in carbohydrates, right? That is the rule, a gross rule what we follow. So healthy diet with green leafy vegetables, lot of nuts, fruits will going to give you a very healthy mind, that I would say. The third thing is the sleep. Adequate amount of sleep is most important for your brain. That 7 to 8 hours of sleep will going to detoxify you from many things. 7 to 8 hours in the sense, it should be, you should go to bed by at least 10 or 11 and you should spend that 7 to 8 hours in a healthy sleep, because there is some hormone called as a melatonin in the body which starts secreting by the time of 7 to 8 in the evening hours, and it reaches its peak by 2 a.m. to 5 a.m. in the morning. So that gives you a very good night's sleep. So proper sleep is again a key factor for the healthy mind. Fourth thing I would say is cutting down your sugars, alcohol, smoking will going to give you a very healthy mind. Stress management, again, it is the most important. Stress is something which we really don't talk much about, but stress in all the ways it will going to contribute to decline your brain function. There is a release of certain hormones called as a cortisols that will just raise your blood pressure, that will keep you tired all the time. You lose the focus, and ultimately you end up in getting problems like dementias or else any kind of a strokes and all. So these are the 4-5 parameters which one should always look into, have a healthy mind or else healthy brain.
And what you should not do is that you should not what we should not do to ensure that our brain is hampered.
Yeah, so as I have said, no alcohol, no smoking, and trying to cut down sugars and deep fried items is the major important thing. Other than that, avoid using excessive using this usage of the mobile phones, screen time. That will going to give you very promising results. And other than that, I would say stress management, as I have mentioned. So avoiding a unhealthy diet, managing your stress, and cutting off the gadgets will going to give you definitely a very practically I'm speaking about all these things, so that will going to give a very healthy brain.
My childhood say we have seen these games like brain games that you play. Many a times they used to say play chess because it helps you focus, it helps you to become more smarter, sharper. Is it true you really become sharper after playing games like chess?
Yes, definitely. So these are all we call them as a mind the cognitive enhancing ways to improve your memory or else the thinking capacity. So definitely learning a language or else playing games like Sudoku, chess is having a very proven role in controlling brain related issues. Could be dementias or else any kind of other stress related things can be easily controlled by keeping them into your daily activities.
We have heard that someone who's good, fit and fine suddenly gets a brain stroke. So now, is that something which keeps on piling and eventually gets you into brain stroke situation, or it is just a sudden, you don't even have any slight inkling of what's going to happen?
So yes, it is very unpredictable, because these days we have coming across the news like suddenly a hale and healthy businessman or else an actor have collapsed and then suffered a heart attack or else some brain strokes. It is not so common also. Could be some genetic related thing or else a hidden plaque or else a hidden clot which might have just traveled and then got affected in that particular point of time. But there are so many modifiable risk factors, I would say. Could be diabetes, hypertension, or else smoking, drinks, uncontrolled cholesterol. They are the major factors which can be modifiable, I would say. Unmodifiable risk factors, we really cannot touch upon our genetics, what we have. There are young strokes we are coming across where they had a genetic problem and they have landed up into an emergency with a stroke. And after ruling out and then getting then particular analysis, we will come to know that this and this kind of a mutation was there. That's why he landed up in having kind of a stroke, which is quite very, very rare, I would say.
Is there any injection or something which can prevent you from getting the brain stroke?
Yes, definitely. So stroke, when we say that stroke, what is stroke exactly? The suddenly person was okay few minutes back and he ended up in having some kind of a balance issues or else the eye related problem or else his face has become like drooped out and then his arm become weak or else he was not able to speak for some time. He started losing the balance. So these are all the classical symptoms of the brain stroke. The moment anyone develops such kind of symptoms, I would say that they must rush to the emergency, because if they are reaching within 4.5 hours and the stroke what they are getting is because of some clot and all, then definitely it can be easily reversible just by giving the clot buster injection.
It's like a heart stroke.
Yes, it's a heart stroke. Heart stroke and then the brain stroke, they are quite similar. The dose of and then the medicine what we give, that actually differs. So here, yes, for the brain stroke, if they are reaching within 4.5 hours, I would say even within 24 hours, these days we have something called as a mechanical thrombectomy, what we are practicing at Manipal Hospital. If there is a very big clot which is visible in the brain, that can be taken out by putting a stents and all.
So also after strokes, we have seen people getting paralysis attack. They are not able to walk. They just get bedridden.
quite unfortunate. So that's why I'm telling, the moment they reach at the earliest to the some tertiary care center or else even any government hospital in Goa, yes, most of the doctors are well equipped, and then they are at least aware that this patient will be referred to the higher center. The moment they go to the higher center, if it is in a permissible window, they will start on the certain medications. If not clotbuster injection, if not the injection, at least the tablet form, the double blood thinners, I would say, if we start them, there is something in our book says that at the end of 3 months we calculate some scores and all called as a modified Rankin score. So patients who have reached the hospital at the earliest, they have shown a very good recovery at the end of 3 months. Unfortunately, if they are delaying, or else the clot is really big, or else it has caused a significant area of the brain damage, as quite unfortunately they will end up in becoming a bedridden patients. But at least in this era, with this kind of facilities in Goa, I don't think people are really getting bedbound.
Are there any symptoms which are warning for me to say ki yes, I might get a brain stroke now?
Yes, there is something called as a transient ischemic attack, where a patient will suddenly get some kind of a blurring of vision for time being, and it will get okay within hours. In fact within 1 day, I would also say, some kind of a blurring of vision, or else some speech problem. For time being, his hand was not moving and became all right. He was losing the balance and he became all right. We call it as a transient ischemic attack, which is one of a kind of a presentation where one must immediately rush to the hospital and get evaluated properly by the neurologist, because in such situations what happens, a small clot will go and stuck into the brain, where that part of the brain will stop functioning for a while, and luckily that clot is not so strong enough to cause that damage, and it will get removed from the body by the blood pressure and all those different mechanisms. If we identify any kind of a clot during the examination, even if that patient is particularly fitting into a criteria of having a transient ischemic attack, we start them on the double blood thinners, and we will tell them to follow certain protocol, and we can prevent many strokes. The patients who are experiencing such kind of a problems, if they don't get notified, then definitely majority of the patients will going to end up in getting a stroke within a week.
How do you rate facilities as far as neurology is concerned in Goa, overall government or even private? And you can also tell us about Manipal hospitals.
Definitely, it is wonderful, I would say. Not only Manipal, in even the hospitals like GMC, they are well equipped with each and every scanning facilities, all the blood test parameters, all the injections. So it is superb. I would say that is on a scale of 10, it has a 10 on 10 kind of a facility Goa is providing for the patients with the neurological problems.
Do you have to shift a patient sometimes to Bombay because of...
No, I would not see, because at least for the basic, not only basic, till certain end. For example, if someone needs some special epilepsy surgery, or else some devices we are putting, even because that is possible only in few cities of the India. For example, there is a procedure called as a deep brain stimulation, what we do in case of a Parkinson. So those things are done only at particular places. And for example, certain epilepsy surgeries and all, they're not being performed yet in the Goa, but I don't think that will going to be get delayed more over here. We're going to start that also in few years.
You also must be handling a lot of accident related cases in your emergency, and whenever someone falls down from a bike or hits, the first thing people check about is neurology, whether it has hit your brain or I don't know whether skull, brain, whatever it is or not. So tell us about that.
So any kind of a head injury, so there is something called as a red flag signs, what we usually look for whenever a patient comes to the emergency or else even in the OPD. If the patient has a head injury, if he experienced any kind of a vision related issues, he's not able to speak for a while, or else he's hearing some buzzing kind of a sound in his or else there was some kind of a bleeding which was occurring from the nose or else from the ear or else the mouth, and he was not able to lift his hand or else leg, or else he's getting some shock like sensation in his hand and all. So they are the patients who actually need a little bit of a more scanning and then the evaluation, because there are so many things called as an internal brain hemorrhage, fracture of the cervical spine which might be pressing upon the nerves. So has to be addressed very quickly. So we must remember those red flag signs what I have told, and they are the one who need to be get assessed quickly. Otherwise, a small head injury without any kind of a red flag signs, if the patient is not on any blood thinner and all, they can be taken easily. That pain and everything will get reduced within 3 weeks.
You're also witnessing lot of lives saved because of helmet. Use
Yes,
of
definitely.
helmet.
Yeah, definitely. Sam, helmet is a such kind of a thing. We can just prevent those unnecessary head injuries and then the neck injuries just by wearing the helmets. In fact, that impact which has happened almost probably 100 times, that intensity will get reduced, and then he will just get prevented from the dangerous problems like bleeding inside the skull and all.
Last question. Tell us about facilities in Manipal right now. What are the new facilities that has come? Any new
Yes.
machines? Because I know when we were talking about knee replacement surgery, they were talking about robotics, and other
Yes.
stuff.
So in that terms, when it comes to the neurology department, we are equipped with the MRI machine, CT scans, which are one of the most recent. In fact, we are doing it for the years also. So we have a good MRI facility, CT scan, and also which we use to identify patients who are having strokes, brain tumors, or else any nerve related issues. And when it comes to the neurophysiology department, we have a electroencephalography. We call it as a EEG, like heart ECG. We can also map our brain to know that how the brain is functioning, or else is there any kind of a tendency to get the fits or not. And there is also something called as a nerve conduction studies, what we are doing, visual potentials. It could be electromyography to identify the nerve muscle disorders. We have a different set of treatment related things, like we have a thrombolizing agents, we have a mechanical thrombectomy, in fact endovascular surgeon is with us, Dr. Charu, so he performs the stent related things and all in strokes. And we also have a team of cardiothoracic vascular surgeons, where if someone is having a plaque or else a clot in the neck, we can get it operated if the patient really needs it. We also have many almost what the metro cities can provide. So all those kind of facilities are available, except for the rare cases what I was speaking about, like this epilepsy surgeries and then the deep brain stimulation. Otherwise, I think we are much equipped with all the things.
Thank you, doctor. So this was Dr. Amrut from Manipal Hospital. He's a consultant neurologist. So the best way to save your brain is whenever you are having any slight doubt about your disease or anything, the best way is to consult the doctor as soon as possible. You can rewind and check what are the measures that doctor has suggested to make sure that you have a healthy brain. And still, if you have any questions, you can leave your questions in the comment section. We'll make sure that we'll send those questions to the doctor, and he will reply to us, that we will cut, paste and answer your questions in the comment section. And still you have more questions, then there are a couple of options. One is doctor is available in Manipal Hospital. Go with prior appointment. Don't just barge in. You have to have a prior appointment and meet him in Manipal Hospital. Or they have outreach clinics in Mapsa, in Ponda and Vasco. And can you just tell us when are these clinics open? They are on particular day?
Mostly on the every week we are doing it actually. So that's like in Mapsa we go on Thursdays, and in Vasco we see patients on Friday.
Mapsa Thursday, Vasco Friday,
and then Ponda on Mondays.
Ponda Mondays. So you need not even come to Dona Paula. They are there in your city. You are watching this podcast on your favorite channel, Goa News Hub. Keep watching us.